My name is Valeria Timoshenko, and I will be going over the effects of bullying on mental health. Why research the effects of bullying on mental health? Bullying can be dubbed as simply something people go through in their life. By ignoring the issue with bullying, it can cause more harm than good. By looking at harmful impacts that bullying has on development and seeing how severe it can be, we can branch together to come up with solutions. The first step before addressing an issue is to understand why it is an issue in the first place. That's the goal. That's the goal of this research: to deeply understand the effects of bullying on development, to see it's not a minor concern but a major one. So it's mainly just because people think bullying, it might be just a simple thing that people go through in life, but not understand how impactful and dangerous it actually can be to someone. So that's the goal of this research, is to really look at the dangers of bullying. And the first article I have it's called The Traditional School Bullying and Cyberbullying: Prevalence, the Effect on Mental Health Problems, and Self-Harm Behavior. So this article starts off by defining bullying as intentionally aggressive behavior that is repetitive and involves an observed or perceived power imbalance from victim and perpetrator. This article examined both traditional face-to-face bullying and cyberbullying. Children who experience bullying are at increased risk for multiple psychosocial consequences, including struggling academically, low self-esteem, anxiety, and depression. They also did find that there are higher levels of bullying in grades 6 to 8. They also found that there have been links that can cause ADHD, self-harming tendencies, and suicide. This was done in Turkey with a sample size of 6,002 middle school and high school students, ranging from 11 to 8 years old, where they had 46% girls and 54% boys in the study. They did 50-minute surveys, and out of that survey, they found that there was like a reciprocal relationship between bullying and mental health problems, such as self-harm behavior. And in that, they found that there were higher instances of self-harm, and that the lower socioeconomic status the person has, the harder it hit in terms of depression and self-esteem. They found that 7.5% of the victims reported self-harm behaviors, as well as higher levels of depression, anxiety, and lower self-esteem on an overall scale. And they also showed that females carry a greater risk for poor mental health. And so there's a little chart on the bottom just kind of showing the prevalence of bullying, and we can see here that it does impact self-harming tendencies, suicide, depression, and anxiety, and it's a lot higher for grades 6 through 8. This article looked at Trinidad and Tobago, looking at the link between bullying and mental health symptoms. They used a retrospective chart with new patients between June and May of the following year, with a total of 283 patients registered to a clinic. The largest group in the mental health clinic were ages 10 to 14 years old. They found out that in the clinic, 57.3% of the youth have been bullied, were the ones bullying, or both. So it was just a mental health clinic, and out of those patients, they found that 57% of those have been either bullied, bullying, or both. And they found that physical bullying was more prominent with boys. Verbal bullying was relatively equal across both gender, and social and cyberbullying was more common between the girls. Everyone that fit into those bullying categories, they found that they had families that had a history of mental illness, as well as the teens showing high rates of suicidal behavior, self-harm, sadness, and disobedience. So they called for more research to be done in terms of what would be the best clinical approach to address the issue. But they did see that the teens that were more bullied did have those higher rates of suicidal behavior, self-harm, sadness, and disobedience. And it became an issue where it was more than half of those teens administered in this mental health clinic that needed this assistance. This article This article was more of a literary review approach. So it looked at data that looks at bullying at those with intellectual disabilities. So the severity and frequency of bullying tend to increase with the length of exposure. So I think it's more of like they were looking at the consequences of those who have intellectual disabilities and how bullying affects those specifically. The article defined bullying as the presence of persistent, threatening, and aggressive verbal behavior or verbal abuse directed towards others, especially those who are younger, smaller, weaker, or in some condition of relative disadvantage. They found that the psychological consequences of bullying differ depending on sex. Females were more frequently reported to have anxiety and sadness, while males reported more problems with social skills and disagreement with teachers. They also found that 92% of the bullied children suffer psychological consequences, including anxiety, stress, anxiety, sadness, fear, social isolation, loneliness, low self-esteem, and 10% of the victims did engage in suicidal ideation or have at least one suicide attempt. And out of these teens that had all of these disadvantages, adolescents with some type of disability are at a greater risk of being bullied, reaching as far as 50% more likely 50% more likely for clinical depression. And students with intellectual disability are 36.3% more likely to be bullied. Individuals with an intellectual disability tend to show less insight and awareness of their distress and are at higher risk of suicidal thoughts and behaviors, with some studies showing rates as high as 42% more likely. They used Prisma as their data collection source and found focus on those with a alleged and confirmed diagnosis of intellectual disabilities, focusing more on the psychological aftermath. They found a significant association between peer victimization and depression anxiety. This study suggests that the negative impacts of bullying on mental health is exacerbated among individuals with intellectual disabilities, coming from higher levels of bullying and less capacity to cope. So they have more psychiatric symptoms and more mental health problems, such as depressive symptoms, anxiety symptoms, and low self-esteem and a lower quality of life, just because they have higher levels of bullying and less ability to actually process what it is that they are going through. This study decided to go a different route. This study explored the effects of workplace bullying on employees' mental health in a hospital in Ghana. So workplace bullying is a global and pervasive issue and has consequences on both the workers and the quality of the work they do. It's a range of hostile behaviors ranging from verbal abuse, intimidation, exclusion, sabotage that undermines a person's dignity. Bullying not only affects the physical well-being of others, but also affects teamwork, job satisfaction, and quality of care. Globally, workplace bullying in healthcare is quite high, with reports of 39.5% in Brazil, 52% in South Africa, 40.9% in Lebanon, and 67% in Australia. Bullying in healthcare professions has been linked to stress, burnout, absenteeism, psychological distress, and physical illness. It also leads to an increased risk of medical errors, negative patient outcomes, and impaired overall healthcare delivery. The study did use a qualitative phenomenological design to find the essence of the phenomenon. The victims reported a higher frequency of illness, weight loss, increased physical exhaustion, sleep disturbances, fatigue, and physical exhaustion due to the bullying. And the emotional outcomes included emotional depletion, anxiety, stress, depressions, and feelings of hopelessness. And the bullying impacted the workers' personal relationships as well as overall quality of life. So the workplace bullying not only impacted their own self, but it also impacted the work that they had to do with dealing with the stress of the bullying and the workspace. So it just kind of shows that bullying, no matter where you go, it affects your headspace, your mental ability to function clearly, as well as the work that you do and your overall quality of life. This research looked at psychological effects of bullying on the mental health of adolescents in secondary school. It was a cross-sectional research design with a sample size of 304 students. They defined bullying as aggressive behaviors comprising of intentional harm and power imbalance between victims and perpetrators in the school. Bullying in adolescence is associated with psychological issues such as low self-esteem, anxiety, depression, and academic struggles. The research shows that the duration of bullying doesn't impact the effects of psychological well-being, but both long and short-term bullying have effects. In their study, a majority were female, accounting for 88.2% of the study, And they found that the highest rates of bullying happened between grades 9 and 10. 14.1% were bullied only once, 33.3% were bullied 2 to 3 times a month, 3.6% once a week, and 4.3% were bullied several times a week. Those who were bullied were at higher risk of depression, higher stress levels. Those who were bullied more frequently have more severe depression. Females were more impacted by bullying than their male counterparts, as they experienced more psychological problems. That also goes for they experienced more sexual bullying as well, but relational bullying was experienced relatively equally among both genders. So they both students had the impacts with the depression. The more they were bullied, the more the depression. But even if they were bullied once or twice, they still had these depressive symptoms. So this is looking at specifically cyberbullying. And this one was really interesting in a sense of this. So this study took place in Russia with the goal of looking at cyberbullying and its physiological and psychological effects on teenagers, as well as possible interventions. They used system analysis and synthesis of international domestic literature, surveys, and diagnostic tests. They did find that victims of cyberbullying had higher levels of anxiety, depression, isolation, and decreased activity in both life and school, and higher levels of frustration. They found that 1/3 of the teens in Russia are subjected to cyberbullying, and that can be also associated with more physical violence that they are perpetrating outward after being bullied online. There are many risks with the internet, such as addictions and financial fraud, and they found that it can be really difficult for teenagers to navigate the internet. It's also been linked to mass suicides. They found that the victims of cyberbullying were more likely to consider, attempt, or successfully commit suicide. They found it necessary to provide psychological and pedagogical prevention to focus on their mental health, and educational organizations so that more people are aware. From their surveys that they sent out to teens, they found that 88 teens, that out of 88 teens, 47 at least became victims of cyberbullying. 12 of them were cyberbullies, even though they were cyberbullied because they wanted to treat aggression with aggression, and only 15 teens that were cyberbullied did not want to cyberbully back because they were aware of the consequences. Out of the main cyberbullies who admitted that they were cyberbullies, the cyberbullies found it funny and wanted some authority in the friend group, so they did it as a joke to kind of have a power play in the friend group and just to laugh at someone. They found that teenagers don't typically confide their problems, and this is one that is rarely mentioned out of fear of publicity, so they don't want it to come out and to be even more severely bullied online. From the bullied teens, the teens that experienced cyberbullying, 40% showed a high level of anxiety, 50% showed higher level of frustration, and 40% showed low level aggressiveness, which indicates inability to stand up for themselves. And they do want to push out more therapy to restore self-confidence and to kind of work through that. They also defined that there are different types of cyberbullying, such as flaming, which is like short emotional replies between 2 or 3 people, baiting victims, overloading personal communication channels, slander, so saying something offensive and untruthful, imposture, so baiting someone, so someone's pretending to be them and doing something dumb. And all of these types of cyberbullying do greatly impact the teenagers in a negative way. So this particular study aims to understand the association between bullying behavior and self-harm, so looking specifically at how those two are linked, as well as protective factors. They surveyed 16,182 teens ranging from 12 to 19. They found that self-harm is a major public health problem, and teens are more at risk for self-harm. They couldn't find a consensus on the definition of self-harm in literature, but in their effort, they defined self-harm as self-poisoning or self-injury, irrespective at the apparent purpose of the act, as a broader definition. So they kind of just said any type of self-injury for any type of purpose. They found that bullying is associated with self-harm and that girls who were bullied are 3 times more likely to engage in self-harm, while boys are only twice more likely to engage in self-harm. One explanation that they tried to portray is that bullying does increase feelings of anxiety and depression, which can lead to self-harm as a mode of self-regulation. Out of the teens they surveyed, 15.3% had engaged in self-harm during the last 12 months, with more girls than boys. 11% of those teens have been bullied at least once a month. 3% were both bullied and perpetrators, and only 2% have been the ones bullying. Self-harm was highest in the bully victims, and they are 6 times more likely to self-harm. Depression accounted for part of the relationship between bullying behaviors and self-harm, as well as anxiety and parental conflict, which were all associated with self-harm. They found that parental support and friendship were the strongest protective factors for self-harm. With parental support, they saw a decrease of about 10% in that behavior. So in general, they found that the highest risk for self-harm were grades 8 to 10. So those teenagers experiencing bullying from grades 8 to 10 were at the highest risk for self-harm. They found that there's also a higher link, but they did find that if the teenagers does have a good, strong parental support system, then they are less likely to self-harm and or reduce self-harm in the future. This one was a different approach. So this one looked at the relationship between those who experienced bullying and victimization, certain for BV, and engaging in murderous behaviors among teens. So this article did not necessarily define what they meant by murderous behaviors amongst teens, but we're just going to take it at surface value as intention to do murderous harm. So they surveyed, and this was done in China, they surveyed a total of 5,724 middle school adolescents around the ages of 12 to 13 in China. In general, bullying is a serious global concern, and they found that bullying victimization, as they define bullying, or BV, as repeated intentional acts of violence or aggression that cause physical or psychological harm to a person who is unwillingly subjected to such acts by peers who are more powerful. And this definition includes all types of bullying, from physical, verbal, cyber. And they did find in that college students who have been bullied prior to college were more likely to engage in murder-related psychological behaviors. They also measured impulsivity as part of the cause for those murderous behaviors. And they defined impulsivity as an inadequate planning, premature expression, excessive risk-taking, or inappropriateness to a situation leading to invariability to adverse outcomes. So it's very just they quickly do something, no premeditating, no planning, and it can lead to a various outcome. And it is a key factor on teen mental illness. Kids who experience BV had a higher risk of developing impulsivity in their pathology. In addition, men have higher prevalence of aggression due to impulsiveness. In their study, they had more men they had 2.5% more men, and they found that men had higher rates of verbal, physical, and cyber BV than women, and that women scored higher impulsivity scores. They did find that BV was associated with higher risk of murderous behaviors, plans, and attempts, so they were more likely to consider, plan, or attempt to murder. There was a small difference between gender, but females did have a higher impulsivity from verbal and relationship BV to murderous behavior, and males experiencing physical and cyber BV were associated with murderous behavior. So there was a slight difference in terms of impulsivity, and girls are more impulsive in the relationship and verbal aspect. Men are more impulsive in the physical and cyber aspect. They did find a strong link between BV and impulsivity, and that experiencing bullying victimization can lead to impulsive personality disorders. And in the end, they did find that impulsivity and relationship in between bullying, victimization, and murderous behaviors was significant among men. So if someone has been bullied or has been a victim of bullying, they found that there is a link that it makes them more impulsive and therefore can lead to more murderous or just dangerous behaviors overall that would not benefit them or anyone else. This was a different study that looked at 3 countries, looking at cross-sectional data from 51,405 teens to analyze the association between cyberbullying and suicidal ideation. So they focus more so on suicidal ideation. So roughly 20% of teens who reported cyberbullying also reported suicidal ideation, and suicide intervention was higher among teens who have been cyberbullied. Cyberbullying is indirect, so perpetrators can stay unknown, and it can reach a wider audience with higher frequency. They found that 54% were bullied on social media sites, and 50% of students were identified as bullies. So it was a high number of bullied and bullies in the cyberspace. Since suicide is a global concern, especially for those aged between 10 and 19, it's been growing over years, so there's been more concern with suicide amongst this young population, with evidence showing that cyberbullying might be the cause, as those who are cyberbullied are more likely to attempt suicide. In their study, they had 53% males, 47% females, and with all of them, out of all of the people that had participated in the study, 40% felt lonely, 44.6% consumed alcohol, 14.9% used drugs. Suicidal ideation was 38.4% higher among teens who have been cyberbullied. Females had a 72% higher chance of suicidal ideation since they reported feeling more lonely. There was also a higher increase for those ideations among teens with alcohol and drug use. So women were more likely to have suicidal ideation because they just felt alone and lonely. And those teens who were being bullied, cyberbullied, as well as using any sort of substance, they were also more likely to have suicidal ideations. They found that having parental support, engaging in physical activity, and peer support did reduce suicidal ideation. It has also been explained that though males may feel depressed and hopeless, they are less likely to admit and seriously consider suicide than females due to perception that suicidal is an ideation. Suicide ideation is a sign of weakness. So instead, males respond more with stress, frustration, as well as hatred. So they found that women tend to respond to cyberbullying with suicide ideation, and men respond to cyberbullying with aggression and just putting it out there. And they also found that prevention strategies are required for both in school and policies, but mainly in just having parental support, having peer, and encouraging teens to participate in physical activity, as well as letting them know the dangers of feeling depression and anxiety and loneliness and mixing that with drugs and alcohol. So this is the final one. This is actually a whole book titled Preventing Bullying Through Science, Policy, and Practice. And for this presentation, I'm just focusing on chapter 4, which was looking at the consequences of bullying. This chapter was extremely in-depth, and so I could not put everything that was found in this chapter in this one slide, so I just tried to break it down to the most prominent and interesting aspects of bullying. But I do recommend this book just to look over this chapter overall, because it's very interesting, just the deep impact of bullying. So they looked at physical consequences of bullying. They said they can be immediate, like physical injury, or long-term, like sleep disturbances. So one study found that children who were chronically bullied had greater adiposity. So adiposity refers to the state of being fat or the presence of excess fatty tissue in the body. So they found that if we take 2 kids or teens and one gets bullied, one doesn't, the teen that gets bullied has a higher chance of adiposity as opposed to the one that wasn't bullied, which was really interesting, as well as elevated blood pressure and inflammatory markers. The emotional effects of bullying lead to somatic disturbances. Stress and anxiety related issues from the bullying include sleep disorders, gastrointestinal concerns, headaches, palpitations, and chronic pain. And they found that children and teens who had been bullied are twice as likely to have psychosomatic disturbances. So bullying not only affects them in terms of having higher rates of depression and anxiety, it also does impact them physically. And the sleep disturbances, stomach pains, headaches, chronic pain. When they are bullied, it activates their stress system centered on the hypothalamic pituitary adrenal axis, which produces hormones for survival, but extended use leads to problems affecting the brain, hormone levels, and biomarkers which affect behavior. The prolonged stress also impacts the circadian rhythm, which can lead to difficulty sleeping and waking up, as well as problems with emotional regulation, learning, and mood disorders. They also found that the brain processes social pain So feelings of pain that follow the experience of pure rejection, ostracism, or loss, the same way as physical pain. So our brain processes both of those pain the same. And because it does, there's also an element of memory loss during bullying, as the prefrontal cortex isn't focusing on remembering, but surviving. The brain literally becomes altered when the teen and child is being bullied. Those who are bullied internalize the issue, and that is where issues like depression, anxiety come from, but they also externalize with impulsive, aggressive, and risky behavior, including substance abuse. And individuals who are bullied are twice as likely to develop psychotic symptoms, as well as risk for poor academic achievement. So when a child or teen gets bullied, it affects their brain, their stress hormones, that in turn affects their brain development, and that can lead to a lot more issues beyond just, I mean, it is a lot just to deal with the depression and anxiety, but it could lead to aggression, risky behavior, substance abuse, and poor academic behavior. So when it comes to the effects of mental health that bullying has, it is clear that they are prevalent and consistent. Most of the research showed that individuals who have been bullied have a higher risk of developing depression, anxiety, suicidal ideation, self-harm, and low self-esteem. But it doesn't go there. Like, the quality of life goes down. Their sleep gets, they can't sleep. They have a poor quality of life, and so on. And without support, the consequences can be dire. Most of the articles also did note how family support and education is one of the key prevalent factors to try and undermine the negative impacts of bullying. So bullying, out of this, all of these research articles, I kind of try to take as many different approaches to bullying as there are, just get a more well-rounded understanding of the effects of bullying, and just looking at how, it does impact suicidal ideation, self-harm, depression, anxiety, as well as more aggressive and risky behavior, as well as just fatigue and physical exhaustion. And it's a very scary to think that how bullying, even if it happens for a short period of time, can have such negative consequences on a person's well-being. But it is good to know that family support, educating the public, educating the teens can help prevent the negative impacts of bullying. So in the end, bullying is something that most people are aware of, and to some extent I have experienced it firsthand. It won't suffice to say that it's just a part of life when the consequences of bullying are so severe. By looking at what bullying does to the mental health of someone, there needs to be more conversations about awareness and preventative measures. The correlation between bullying and mental health issues like depression and anxiety can be addressed and hopefully minimized as awareness spreads and breeds a more empathetic environment. I think if we just become more aware of what bullying does to someone and what it can lead to, then maybe in an ideal world we can have a collective effort to try and help each other out and be kind, and maybe look at policies when it comes to cyberbullying and work bullying, and prevent environments that are safe for our teens and adolescents as well as adults. So this is the first page of the references. This is the second one. Thank you so much for listening to my presentation, and I hope you all have a wonderful day.